We're back. It's News Talk. Mary Chamberlain joins us from the Masonic Care community to talk about an event called Being Mortal. What's the secret? We do have this documentary that's going to be shown at Masonic Care community, and this is just really to get a conversation going, open the dialogue within families. And I know you've done similar events in the past with similar movies, but it just goes to show you, now here's another film, so it must be a popular topic. What can we expect at this event?
Well, for this film, this is a film that follows Dr. Atul Gawande, who's a surgeon at Brigham and Women's Hospital in Boston. And his reflections on how poorly he himself was having conversations with his patients about what was happening in the light of a terminal illness. So he recognized that he could do better, and because of that, he sought out his colleagues to learn from them. Some of his colleagues in palliative medicine, doctors that he felt did better jobs of delivering difficult news to patients who were having life-limiting illnesses. So from that, we follow along with him as he works through his own issues with how to talk to patients. I think in one case in particular, he acknowledges that he bought into the illusion that his patients were full of, that there was time, that there was, more that could be done, and he knew all along that there wasn't. And he really regretted, in looking back, that he had not been more forthcoming with them about what he knew to be the true story of what was going on.
Do you think you learned what questions to ask as a patient?
Yes, I think this actually gives the other side of it, in that I think for all of us, we need to recognize that this is a tough topic for us as patients. It's a tough topic for our doctors as well. I think that we expect a lot of them, and there's more work being done to train doctors in this kind of conversation, as well as all other healthcare providers. I, as a nurse, the nurse practitioners, anybody who's providing care to patients.
Well, that's what I wanted to ask you. Who should go to this event? Is it for families with elderly loved ones? Is it for the healthcare industry? Who should really attend this?
I think this is for everyone, and yes, healthcare industry, anyone, because any of us at any time could experience a life-limiting illness, a serious situation, an accident. And what we're asking people to do is to think about the kinds of things that they would want in those situations. It's not an easy topic. It's not something that we talk about easily. And it's not necessarily something that you might even know what to ask if you're not in healthcare. So that's another part of the conversation. We who are in the healthcare business want to help people learn a little bit more about the whole process.
In this case, it doesn't have to be about the estate planning and who gets what. It's more about, if these are going to be the final days, how do you do that the best way possible?
Right. And for everybody who has lived a good life, the ability to make good choices before you get to a crisis situation. We want people to be able to look back and feel that they did well by their loved ones, and that a good end of life reflected a good life well lived, and that's what we're hoping for.
I think you're right in saying that everyone could get something from this. Thank you for coming in. Mary Chamberlain here from Masonic Care Community. We do have a phone number there listed on your screen. Do you need to register to attend, or can you just show up?
Well, we'd like you to register to reserve a seat, but we will accommodate drop-ins.
315-798-4768, and this is happening on September 12th of next week. Masonic Care Community Auditorium starting at